blood sugar. Maybe your foot.
The 65-year-old grandmother suffering from diabetic mellitus has the history for 10 years. One day, in a sunny afternoon,
Grandma, the weather is good today. Can you go out with me to ride a bike? Sure, good idea. Let's go. Candy, where are you going? Ride slowly and carefully. Okay, I know. Ah!
at this moment, Candy looks at her grandma, waiting to be slaughtered.
Why are you looking at me like this? Sorry, Grandma. My bike has just run over your foot. Aren't you feeling hot? What? I don't feel anything. But your right foot is bleeding. What can I do?
After going back, Grandma applied some medication on the wound, but still not improved, and it even showed a sign of getting worse. They drive the grandma to the hospital, and the doctor is examining her physical status.
What's wrong with your foot, Grandma?
My granddaughter rode the bike and hit me by accident. I will spill some medicine on the wound, but it did not work.
Doctor, my mom's leg was injured by the bike a few days ago. My daughter said Grandma had no feeling about the injury. We've been noticing the wound on her leg since then. I've helped to apply on some medication, but the wound is not getting better. It has become worse since last week.
Okay, let me start with the wound treatment and check her blood sugar level as well.
After treatment and blood sugar level test, it shows the value of 202.
Wow, your blood sugar indicator shows 282. It's quite high. Are you taking any medicine to control it?
Medicine? No, I don't take medicine if I don't feel any uncomfortable.
When was your last visit to the hospital?
It seems to me about 1 year ago.
It's not right. There will be serious complications if the blood sugar is not well controlled through medication. The consequence can be fatal. Take this time as an example. You had been trampled by a bike and caused bleeding, but you didn't feel anything. That is because your sense of pain had been blocked, induced by the so-called diabetic nerve palsy symptoms. If you don't pay attention to cure this disorder, it may turn out to be a disease called diabetic feet. The worst situation can be amputation of your limbs. Next week, you will need to come back to the hospital and check further about your diabetes. Your nursing staff will give you instructions about how to self-care the diabetic feet.
After visiting the doctor, they go to see the nurse.
Sit down, please, madam. I will tell you some must-know things about how to care the diabetic foot. Please pay attention and listen to my explanation. Okay. You have to learn it carefully as well.
Sure, I will.
Madam, may I ask you, what kinds of shoes do you wear in and out in your daily life?
I usually wear sandals when I go out, but barefoot at home.
It's not appropriate. Since your feet are not sensitive enough to pain and stimulation anymore, you cannot walk with barefoot whenever you are moving with them. If you go out, you should wear a pair of comfortable shoes that can fit well and protect your feet. For example, sneakers, jogging shoes are good options. Do not wear sandals or slippers, which cannot cover your toes, in order to avoid the injury directly caused by the external object. While at home, you can wear the shoes, which has some covers on the head of the shoes, but leave some holes on the top for air circulation. When you wear the shoes, you also have to wear the socks, which we advise to be white color. That is easier to identify the breeding, if any.
Thank you. I seldom wear in white socks before, but now I know it. I will do it now.
Excellent! Remember not to wear those kinds such as knee-high stockings that are too tight to block the blood circulation.
Oh, I see.
That's right. Now, take off your shoes, please.
Grandma, let me help. Take off your shoes.
Do you cut toenails by yourself?
It's me to help cut the toenail because her eyes is not good now. Actually, her toenails are very thick and difficult to cut. I'm always worrying about hurting her toenail when cutting them.
Okay, elders' toenails are usually thicker than healthy young people. Before cutting them, you can make her feet softer by sinking in some warm water for 10 to 15 minutes. Be careful about the water temperature. Don't make it too hot.
Okay, I know it.
Besides, watch this. You cannot cut them like this. You must trim the toenails at the same level like this. You may also use a file to assist trimming the nails into flat and round.
Oh, okay, I understand.
Remember to dry your feet after bathing, especially those parts in between the toes. Otherwise, the remaining moisture will easily cause infection. Candy, assign your task. You must be responsible for checking your grandmother's feet every day. If there is any wound, remember to tell Dad.
Okay, I will. I will do my best.
Good. You can do very well. I believe you can be a little good nurse at home. By the way, if you are feeling to dry off your feet, you can spread some lotion on them. But remember not to leave the cream in those places between the toes. Otherwise, the moisture will stay inside with them. You need to pay special attention to it.
Sure, I will. Candy,
Hi, Daddy.
you can also help remember it.
Yes, Daddy.
The last point, Grandma must remember to return for the follow-up regularly and take medicine on time. You have to make sure that the blood sugar level is maintained within the normal range. It will reduce or extend the occurrence of other complications. Your family members also need to remind her about the time of taking medications and returning appointment.
Thank you so much. We will keep in mind about this point. When should we come back next time?
Let me see. You will come back at 9 a.m. on 5th of May. I've already booked an appointment for you. Next time, I will tell you some about diet control and ways of doing exercise. You have to come back to learn.
Okay. I will learn it and will remember it. Thank you, nurse, for letting me know so many important information. I will take medicine on time and will take good care of my blood sugar level. I will also take good care of my feet.
Thank you so much.
Thank you.
You're welcome. Take care.
See you next time.
Okay, bye.
Bye.
我自己的神，在我活的地方，我和我最后的倔强，握紧双手，绝对不放下。一站是不是天堂？就算失望，不能绝望。我和我骄傲。 这一次